Okay, so I've basically gained my patient's consent to replace a gastrostomy button. Following that, I've washed my hands following the 7 steps of hand washing, and then prepared the equipment that we'll need for the gastrostomy replacement. So for this replacement, we use clean technique. Okay, so as you can see, this is a makeshift belly, and this is the gastrostomy button that we'll be replacing today. To start off, you need your empty syringe, and you need to find the balloon port, which is this one right here. And then all you need to do is hold the button in place and stick the syringe to the balloon port. And as you can see, it moves by itself. So the pressure from the balloon actually pushes the water back out. Okay? Okay. So once that's done, make sure that your hand stays holding in the button, because now the balloons, there's nothing holding it. Okay? Since you deflated the balloon. And then if you don't get exactly 5 mils, don't worry, because usually the balloon leaks, so it's normal. Okay? Alright, once that's done, you need your lubricating jelly. So you can just put a little bit on the tip of the new button to help it slide in smoothly. Okay? Make sure you don't touch the long tube that goes inside the abdomen. For this, you have to be quick. So once you pull out the old button, you have to put the new one straight in. Okay? So what you do is you pull out the old one and the new one comes straight in. Again, make sure that you hold the button in place, as at the moment there's nothing on the other side that's holding it in. Next, what you need is your syringe with your 5 mils water. Put in the balloon port, and this one you have to push in the water and make sure that you hold the back of the syringe, because as you saw earlier, the water pressure from the balloon will come out. Okay, so hold it and remove. Okay, once that's done, give it a little tug just to make sure that the button is now in place. Okay, so that's all done. Now what we have to do is we have to get some stomach content, so we'll aspirate some stomach content and use a pH strip to test to make sure that the button is in the correct place. And to do that, you need your feeding connector, which you need to connect to your button. As you can see, there's a line here, which you have to align as well here. To connect it, you have to put the lines together. And then there's an arrow that tells you, so there's an arrow that tells you to lock to that direction. So you just twist to that direction. Once that's done, all you need is your 60 ml syringe. Connect it to the connector. Make sure that you unclamp, and then try to draw out some aspirate from the stomach. Obviously nothing's gonna come out here because this is for demonstration purposes only, but usually you just need this much, just a few drops. Before you take your syringe, make sure that you clamp it back in. Remove the syringe and then remove the connector. So you're just going the opposite way to the lock. Pull it out and cover the button. Okay. So once it's done, you need whatever you aspirated from the stomach and a pH strip. What you do is you cover all 3 colors, and this is used to test the pH balance of the stomach to ensure that the button is in the correct place. So it should compare to 5 or below. If it's more than that, then recheck again, and then if you're not sure, ask your supervisor or a senior nurse to help you out. Okay, so you don't necessarily have to clean the area when you're changing the gastrostomy button, but if you would like to, you could always use a gauze and pull it a little bit out. As you can see, there's a little bit of space around, and you can just tap around, clean around the area. Okay, and that's how you change a gastrostomy button.